The menstrual cycle is a natural biological process that happens in the female body. It is a series of hormonal changes that prepare the body for a possible pregnancy. This cycle is a sign of good health and an important part of being a woman. During the menstrual cycle, an egg matures in one of the ovaries. At the same time, the lining of the uterus thickens to prepare for a fertilized egg. If the egg is not fertilized by a sperm, the lining of the uterus sheds. This shedding is what we call menstruation or a period. The menstrual cycle is controlled by hormones. Hormones are chemical messengers that travel in the bloodstream. These hormones tell different parts of the body what to do. The menstrual cycle is a complex interplay of hormones like estrogen and progesterone. Understanding your menstrual cycle can help you understand your body better. It can also help you plan for pregnancy or avoid it. It's important to remember that every woman's body is different. The menstrual cycle is typically divided into 4 phases: menstruation, the follicular phase, ovulation, and the luteal phase. Each phase has a different length and involves specific changes in the body. Menstruation is the first phase of the cycle. This is when you have your period. During menstruation, the lining of the uterus sheds and blood and tissue leave the body through the vagina. This phase usually lasts 3 to 7 days. The follicular phase follows menstruation. This phase is characterized by the growth of follicles in the ovaries. One follicle will eventually become dominant and release an egg. The follicular phase can last anywhere from 10 to 21 days. Ovulation is the shortest phase, lasting only 12 to 24 hours. During ovulation, the mature egg is released from the ovary into the fallopian tube. This is the time when a woman is most fertile and can become pregnant. The final phase is the luteal phase, which lasts about 14 days. During this phase, the follicle that released the egg transforms into a structure called the corpus luteum. The corpus luteum produces progesterone, a hormone that helps to thicken the uterine lining for a possible pregnancy. If fertilization does not occur, the corpus luteum breaks down and the menstrual cycle begins again. While the average menstrual cycle lasts 28 days, it's important to remember that this is just an average. Some women have shorter cycles while others have longer ones. Some women experience regular cycles while others have irregular cycles. Factors like stress, diet, exercise, and certain medical conditions can all affect the length and regularity of your cycle. Tracking your menstrual cycle can be a powerful tool for understanding your body. By keeping track of your period, start and end dates, any symptoms you experience and your moods, you can begin to see patterns in your cycle. This information can be helpful for managing your health and planning for pregnancy. There are many ways to track your menstrual cycle. You can use a traditional calendar, a period tracking app on your smartphone, or a combination of both. Choose the method that works best for you and stick with it. Understanding your menstrual cycle is an important part of taking care of your overall health. By paying attention to your body's signals, you can learn to manage your cycle effectively and address any concerns with your healthcare provider. It's essential to remember that every woman is different, and what is normal for one woman may not be normal for another. Don't hesitate to reach out to your healthcare provider if you have any questions or concerns about your menstrual cycle. They are there to support you and help you live your healthiest life. Remember, your menstrual cycle is a vital sign of your overall health. By understanding your cycle, you can take control of your health and well-being.